Welcome. Today's topic is diabetic mellitus. Here, we are going to discuss about diabetes under these topics: introduction of diabetes, types of diabetes, special situations of insulin usage, symptoms of diabetes, tests used to diagnose diabetes, ketosis and ketoacidosis, and finally complications occur with diabetes. Diabetic mellitus is a common non-communicable disease. Diabetes mellitus is a disorder in which blood levels of glucose are abnormally high because the body doesn't release or use insulin adequately. There are three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes or pregnancy-induced diabetic. Type 2 diabetes accounts for approximately 90% of the total population with diabetes, and type 1 diabetes affects about 5%. Types of diabetic mellitus: type 1, insulin dependent diabetic mellitus; type 2, non-insulin dependent diabetic mellitus. Type 1 diabetic can occur due to pancreas's failure to produce enough insulin due to loss of beta cells. That means simply no insulin at all. Type 2 diabetes can occur due to two reasons. First one, insulin resistance, which means receptors not functioning properly. Second reason is inadequate insulin secretion from beta cells. That means not sufficient. Type 1 diabetes occurs especially in young people. Type 2 occur mostly in the middle-aged and elderly patients. The only treatment for diabetic type 1 is lifelong insulin therapy. Diet control and exercise also helps. For diabetic type 2 we can use oral hypoglycemic drugs or sometimes insulin together with oral drugs. Diet control and exercise helps to maintain the blood glucose level. Special situations of insulin usage: during pregnancy, gestational diabetes, and in children. During surgeries. Serious infections like pneumonia and trauma. These are the conditions to be treated only with insulin, but not with oral drugs because of insulin's good safety profile. Symptoms of diabetes mellitus. Here we are discussing few main symptoms: increases thirst or polydipsia, frequent urination or polyuria, extreme hunger or polyphagia, unexplained weight loss, vision problems like blurred vision, unhealing wounds, and more susceptible to infections. Tests used to diagnose diabetes: fasting blood glucose or FBS test, postprandial blood glucose or ppbg test, HbA1c test, glucose tolerance test, and blood glucose meters also helps in diagnosing diabetes. By using Benedict's test also, we can diagnose diabetes. But now it is not in use. Fasting blood sugar test. Fasting, as the name suggests, means refraining from eating or drinking any liquids other than water for 8 hours. Normal FBS levels 70 to 110 mg per deciliter. Postprandial blood glucose test. Postprandial blood glucose test measures blood glucose exactly 2 hours after eating a meal, timed from the start of the meal. Normal ppbg level 120 to 140 mg per deciliter. HbA1c test or glycated hemoglobin test. HbA1c is your average blood glucose levels for the last 2 to 3 months. If you have diabetes, an ideal HbA1c level is 48 millimoles per mole, or 6.5% below. This is something that's made when the glucose in your body sticks to your red blood cells. Your body can't use the sugar properly, so more of it sticks to your blood cells and builds up in your blood. Red blood cells are active for around 2 to 3 months, which is why the reading is taken quarterly, as red blood cell lifespan is 120 days. A high HbA1c means you have too much sugar in your blood. This means you're more likely to develop diabetes complications. HbA1c is also a reliable predictor of microvascular and macrovascular complications and mortality. Lower HbA1c lower the risk of vascular complications. HbA1c test can be performed at any time of the day and does not require any special preparation such as fasting. For a diabetic patient, ideal HbA1c concentration is between 6.5% and 7.5%. Other names are HbA1c, A1c, glycohemoglobin, glycated hemoglobin and glycosylated hemoglobin. Glucose tolerance test. Glucose tolerance means ability to the body to utilize glucose in blood circulation. Glucose tolerance test is a measurement of plasma glucose before and after. A specific amount of glucose given orally should provide a standard method to evaluate individuals and specific values for normal and diseases. Benedict's test. By heating an urine sample of a patient with added Benedict solution, turning into red brick precipitation helps to diagnose diabetes. But this method is not in use now. If blood glucose level goes above 180 mg level, glucose will appear in urine. This level is known as renal threshold. Ketosis and ketoacidosis. What exactly is ketosis? The primary source of energy in the body is carbohydrates. Carbs are broken down into glucose for immediate energy or glycogen for future energy. When glucose is not available as an energy source, your body turns to fat as the primary fuel source. Fat gets broken down into glucose, and ketones are produced as a byproduct. The body can use these ketones as an alternative fuel source. There are 3 different ketones: acetone, acetacetic acid and beta-hydroxybutyrate. When your body is getting fuel from ketones, you are in a state of ketosis. Diabetic ketoacidosis. When considering diabetic patient, mostly type 1, he or she is with low insulin in blood. That leads to low glucose uptake in cells. That means no primary fuel source. That is same like a healthy patient is fasting or maintaining a low-carb or keto diet. By the way, no energy for cells. Then an energy need occur. Our body begins to produce energy by using another mechanism. That is, fatty acids and adipose tissues broke and produce energy. That is how keto diet helps in losing weight. Here, a byproduct releases that are called ketones. By long-term ketone production due to diabetes, blood can become acidic. That condition is ketoacidosis. If not treated, it can end with coma or death. Ketosis and ketoacidosis differences. Ketosis is a metabolic state characterized by raised levels of ketone bodies in the body tissues due to the consequence of a diet that is very low in carbohydrates. Ketoacidosis is a feature of uncontrolled diabetes characterized by a combination of ketosis and acidosis. Ketosis is a natural condition. Ketoacidosis is a disease condition that has to be treated immediately. Ketosis occurs with the consumption of a low-carbs diet. Ketoacidosis occurs in diabetic patients. Ketosis means low blood glucose levels. Ketoacidosis means high blood glucose levels. Diabetic complications. Glaucoma, heart attack, diabetic nephropathy, diabetic retinopathy, diabetic foot, peripheral neuropathy, cataracts, stroke, peripheral artery disease. Thank you for watching. Hope you guys enjoyed. See you in the next video. Don't forget to subscribe.